Hi, everybody. Welcome to today's Family Matters interview series. We are being joined today by Michael McGregor, who is the director of the 15 for Me program, a physical therapist, and a certified life coach. Welcome, Mike. Thank you for joining.
Thanks for having me. I appreciate it.
Yeah, we're really excited for today's topic, where we're going to be hearing a little bit more about how to stay active as we age. Talking a little bit about physical activity for older adults. I know our family members will really enjoy hearing more about this. There's always information on the news, and you hear from friends and family what you should do, how much you should do, what's really the benefit. So I feel like this will be a great opportunity for our older adults to hear some really great concrete information that they can take away and start with immediately. Before we start on our topic, Mike, would you mind sharing a little bit about yourself? Just tell everybody, a little bit about your role and what you do.
Absolutely. So my name, again, is Michael McGregor, and I am a physical therapist. I have my doctorate from Marymount University. I am also a certified health coach, and I have received my certified exercise expert for aging adults. And I've been practicing for 20 plus years in the geriatric space or the older adult space.
Great, thank you. So, Mike, start us off with, what are really the benefits of staying physically active as we age? And, how does activity contribute to our overall health and our well-being?
So great question. So physical activity is very important for not only your overall physical health, but also your mental and your emotional health. So your overall well-being. Some of the things that you probably have heard about it is physical exercise helps with your cardiovascular health. It can also help you with maintaining a healthy weight. It's also important, depending on maybe any complexities or diagnoses that you present with, it can help you with your joint health. So if you have arthritis or you have osteoporosis, there's specific exercises that physical activity can really benefit with you. Also, there's a lot in the news, and there's a lot of evidence now supporting that exercise helps with cognitive health, or it helps with brain health. So there's a lot of information out there, but generally speaking, people feel that physical exercise can also minimize risk for cognitive decline. Another thing that is very important for is your immune system. And I think this was definitely evident with a lot of the evidence that came out after COVID, where people that were possibly less diagnoses and had less complexities and had maintained a more healthy weight were at less risk for some either the severity of the hospitalization or even death. So you're doing physical exercise for your immune system is very important to help you sort of ward off infections, or at least minimize the intensity or the severity of any illness that you may encounter.
Yeah, that's a really good point. I do remember during COVID, them talking about persons who had multiple comorbidities or health conditions, definitely contributing to their overall prognosis.
Yeah.
So when we think about things like maintaining our balance and, stretching and flexibility, strength, how can physical activity, help with those items? Are those also sort of essential building blocks for older adults?
They are, and there's a lot of information that you hear related to fall prevention or sort of balance intervention. So when you're looking at fall prevention as an example, there's a lot of things to consider. So physical exercise is definitely one of them, but there's a lot of other different risk factors that are associated with falls, and sort of most importantly, preventing injurious falls or getting an injury from having a fall. 1 out of 3 older adults do fall a year. That's sure you've heard that stat many times. But when you're looking at balance, one of the things that you want to incorporate into your routine is some sort of muscle strengthening or some sort of strength training program. In addition, you want to also look at doing balance exercises that focus on proprioception or coordination. And all those things will contribute and, again, minimize your risk for falls and help you maintain upright, or again, not having the opportunity to lead to a fall.
That's a great idea.
Yeah, and when you look at flexibility, that could also be something that we see as a challenge, especially with our older adults. If you even just sort of focus on your posture, your sitting posture, as an example, are you utilizing the chair, the back of the chair, to maintain upright? And generally what that's a sign of, if you're unable to sit upright, is a lack of sort of those core postural muscles being able to hold you up. And we spend so much time in sort of a flexed or forward position, where we get these sort of shortened muscles on the anterior side of our body and these muscles on the posterior side of our body being lengthened. And it sort of fixates us in this posture, which potentially can, again, just based on gravity, sort of lead to an increased risk for falling. The other thing is, people begin to lose flexibility in certain muscle groups like your hamstring. So people have a hard time, being able to touch their toes, as an example. And this is a symptom of not doing flexibility exercises, but also how many of us sit for prolonged periods of time. So we see that pretty common, not just in older adults, but in with all ages, especially kids nowadays. We're seeing, my son has pretty poor posture, and part of that is his hamstring elasticity.
Oh yeah,
Yeah.
the sedentary lifestyle, right, working on a computer or having some kind of handheld device, definitely I think is playing a role. And we're seeing that, across the lifespan for sure.
Yeah.
You mentioned earlier about sort of overall health. Are there any specific activities or exercises that you would recommend for older adults to improve their cardiovascular health? I know weight gain and weight loss are also concerns. Can you talk a little bit about those two items? Because I feel like those are things that people can actively and intentionally try to improve, right? Managing weight is something we have a little more control over.
That's a really great question, Lynn. And I think I would probably start off with the fact that most of the time, someone's weight issue, if they consider it an issue or the physician considers an issue, is because more of their nutrition. Obviously, genetics plays a role, and the lack of physical exercise can play a role. But a lot of people exercise a lot, but they don't necessarily treat their body well in terms of the food that they take in or the liquids that they take in. So I always kind of emphasize with my patients, either as a physical therapist or as a health coach, and first looking at nutrition, and not only the right foods, but also the portion size, how often you eat during the day. Again, what liquids are you bringing in? I mean, if you're just drinking water or you're drinking coffee, you are at a much better advantage of not gaining weight than if you are looking at taking 2 sodas a day, or you're taking in these energy drinks, or you're taking in Gatorade and some of these other things that have those hidden calories within them. So that's probably where I would start people off with, is their nutrition. But in terms of actual exercise, the best thing people can really do is anything that they enjoy, which elevates their heart rate. And you want to sort of work your way into sort of an elevated heart rate, and you want to sort of stay there for whatever period of time that you can sort of sustain that, and then slowly come back down from that. So there's a lot of different ways that people can do that. One of them is just doing sort of power walking or brisk walking. So if you're just able to leisurely walk, that's great. But if you're able to add some speed to that power walking, whether it's brisk or power, what we would recommend is trying to do 30 minutes a day, at least 5 days during the week. But really, anything that you enjoy is what I would encourage people to do. Part of the reason that exercise routines fail is because people are told to do certain exercises that they're not engaged with, that they don't enjoy, and then they sort of do it for a period of time, and then they stop doing that. So if you're not a walker, or you don't like to go to a yoga class or do a Tai Chi class or go to the gym, and you enjoy gardening, you just work on maybe the intensity of your gardening. So maybe increase the speed that you go from one task to another task. Doing household chores is another great example. So if you're doing a certain portion of your household chores, just maybe speed it up a little bit, get that heart rate going, and then use the chores as sort of your exercise routine. People that enjoy, maybe if you have arthritis or you've got osteoporosis, if you have access to either a community or a swimming pool, the reason why those exercises are so helpful because it sort of takes the pressure off the joints and allows you to get your heart rate up to that point where you want to get it to without taking or increasing inflammation, in those joints that are already so sensitive. The other thing to take into consideration is whether you want to do a one-to-one exercise or you want to do it in a group. And we'll talk a little bit later about ways to improve your motivation, especially as it comes to group exercise.
Yeah, I really like your suggestion about trying to sort of build it into the tasks you're already doing and the things you already enjoy. Can you talk a little bit more about that? Incorporating physical exercise into daily routines, especially when sometimes folks feel like maybe there's some challenges around doing that, or they have time constraints, they have limited amount of time where they can sort of dedicate to activity. How do you get around those barriers?
Again, another great question. So again, as a health coach and again, as a PT, when I work with patients, what I tell them is, okay, once you're done with me, what's going to be important to you and what it will be sustainable for you. So as an example, if the recommendation for older adults is to do 150 minutes a week of moderate intensity exercise, that can seem very overwhelming to a lot of people, especially if they have never done that kind of routine before. So I will say, okay, the example earlier, can you do a 30-minute walk? Well, that might seem overwhelming for a lot of people. So why don't we start with 5? And then once you're able to do 5, why don't you go to 10 and slowly ramp up not only the level of enjoyment you have for that exercise, but also your ability for your body to appropriately respond to that level of intensity. So sort of breaking things down. Again, even 30 minutes might be a lot at any given one point, but can you do 10 minutes in the morning? Can you do 10 minutes after lunch? And can you do 10 minutes after dinner? So breaking down an exercise routine is really helpful. The other thing is to maybe if you're involved as a caregiver, maybe you're helping to take care of a spouse or you have your grandchildren with you, doing an activity that you guys can do together. So incorporating family time and that bonding time into an exercise routine. So again, if you're working with your grandchildren, what do they like to do? What can you incorporate with them? So not only can you have that bond with them and that special connection, but you can also benefit from doing that activity with them. Again, these earlier examples of, again, chores, incorporating chores. If you watch a lot of television, again, a great thing that I tell people is during the commercials, especially if you have a subscription to something that's, you get the advertisement still, is to incorporate an exercise within those 60-second increments that the paid advertisement comes across the screen. Or just challenge yourself if you're binging your favorite series, after that first episode, take a 5-minute break, do something physically active before you watch episode 2. And that is a good example. Again, you might want to make sure I tell you this, is that you want to make sure you stay hydrated. And hydration is not just something that you do at the end of your workout. Hydration starts from the moment you wake up. And a good example that I work with people all the time is that they're big coffee drinkers, and so am I. So what I challenge myself to do to stay hydrated is before I have my first cup of coffee, I drink a full glass of water with an electrolyte in it to minimize the dehydration that will come from my favorite cup of coffee. So, and then I sort of challenge myself throughout the day again to have that cup of water. Another thing to consider is if you can't attend a live session somewhere, if you can incorporate it online. There's tons of stuff online nowadays. People, you can either pay for those classes, or there's tons of free stuff. If you go to YouTube or some other mediums, you can find some free classes for you to do. So again, finding the consistency of my message is to find something that you like, that you can incorporate into your routine. So it's not anything extra, especially if you feel like I don't have any time to do it. and then find something that's sustainable over time.
I love that suggestion to do short amounts of exercise, within your day instead of trying to find a large block of time. That seems less, stressful and difficult to kind of weave in. If you only need 10 minutes, that seems pretty doable.
Yeah.
So I love that suggestion. So if somebody was going to start a new exercise routine, and maybe they have a pre-existing health condition, maybe in the past they've had to modify or be cautious around exercise. Are there any precautions or modifications that people need to be mindful of if they do have underlying health issues?
Yes. So first of all, doing a self-assessment of sort of your risk. So safety is the most important thing. You definitely don't want to begin anything that's going to put you more at risk than what you're trying to do with the physical exercise, right? So if you have multiple complexities, say you have diabetes, say you have osteoporosis, always the right thing to do is talk to a healthcare professional. Now, it doesn't always need to be your doctor. So understand that most physical therapists, as an example, now have a doctorate. And what that allows them to do is do a sort of a full body screen. And they are considered the exercise experts related to physical activity. So they have the knowledge and the skill base to be able to prescribe an exercise program that sort of meets or needs to be modified based on your needs. But if you do have regular appointments with your physician, it's always helpful to ask that question. And especially if you have access to like a My Chart, a lot of the communication now is online. You can easily send a question to the nurse to bring to the physician and say, hey, I'm looking to start this. What do you think? Do you feel like I need to come in for an appointment prior to that? And they'll generally give you some really good information about you're okay to start, or we would prefer you to come in. Some general sort of parameters is to always start slow and to progress gradually. So as an example with strength training, which is so important. So when most people think of exercise, what they think of and what I've talked to up to this point is general aerobic exercise, walking, getting that heart rate up. But strength training, especially for older adults, is very important. And I would say maybe the most important as we get older. So with strength training, and you've never done a strength training program before, you don't start off with weights. You actually just go through the exercises without weights because there's some muscle memory and some technique that you need to learn and to be able to assess how your body's responding to those exercises before you add weight to that routine. And then once you start adding weight, what we recommend is, again, a slow ramp up. So maybe 50% of what you think you could do, start low. So low weight, high repetition. So as an example, if you're doing arm curls, as an example, maybe just doing a 2-pound weight or a 5-pound weight, doing it 20 times or 25 times. Now, you're not doing true strength training yet with that model, but what you're identifying is how your body's going to respond to that exercise. True strength training is doing a weight that you can do between 8 and 12 times, and you fatigue after that 12th time. And we always recommend people to do at least 2 sets, so 2 sets of 12 in this example. And when you can do that a couple of times, then you can gradually go up in your weight. So that's some general considerations. But again, I always recommend that you go to a PT or to another credentialed healthcare professional to help guide you through it. The other things you might consider if you, again, if you have osteoporosis or you have arthritis, is to choose low impact kind of exercises. So going into the pool, using an elliptical versus running outside, doing the bike, a stationary bike, instead of, again, pounding the pavement on an outdoor surface is going to be beneficial to you. You also want to avoid sort of overexertion. So again, you want to be able to kind of monitor your heart rate or your pulse. So you could do that a couple of different ways. The easiest thing is there's a perceived exertion scale. There's one from 6 to 20, or there's one from 0 to 10. And you basically read this scale, and then based on how you feel, can help guide you to, am I staying in the appropriate intensity, or am I overexerting myself? Again, you want to make sure that you stay in an intensity that you can handle over a period of time. Assess how you feel the next day, assess how you feel the day after that, before you would go higher in your intensity. And then the last thing I will show, just based on time, is modifying exercise. If an exercise doesn't feel right, don't do the exercise. So as an example, people like to do squats, and squats is a great exercise. The challenge with squats is the technique and not overwhelming yourself with the weight. But squats are really helpful. And it's a body weight exercise. It could just be a body weight exercise where you don't add any weight other than what you have on your body. So if you can't get all the way down, you can modify it where you just go these mini squats and just stay in that area. Again, pain-free or very minimal discomfort. But you should never be in intensity where you're having significant or moderate pain. You can also modify it by going against a wall and using the wall to sort of support you up and down in that motion. So that's just one example. And again, if you're looking at exercises, do ones that they sort of cover multiple muscle groups. So you don't have to do that many to achieve really good results. And again, there's a lot of different kind of exercises out there. You might hear something called high intensity exercise. Again, helpful for certain populations, but can be very dangerous to those who can't handle that intensity. So that's an example. If you see that kind of class, or you see like a pretty high flow yoga classes, to definitely check in with a trusted healthcare provider before you initiate it.
Yeah, those are really good suggestions. I like the idea of when you start slow, low weight, really kind of have a handle on your health conditions, what might be issues for you. Talk with your practitioner, whether it's a PT or your family practitioner, just to get a sense of where you should begin and how much time to invest, each day.
Yeah, because a lot of times if you do exercise in a group or you exercise with a friend, that's very helpful. And there's tons of positive things that come from exercising with a friend, including sustainability and enjoyment. But what can happen in that environment is that you compare yourself to your friend. And you want to make sure that exercise is very individualized. And just because your friend doesn't communicate everything going on with them, and they're doing maybe exercises that are harder, they're using more weights, doesn't mean it's safe for them. So always when you're working out with a group or working with a friend, is you still stay to yourself in terms of what makes sense for you and how your body's responding. Always self-assess how you're doing during the exercise, after the exercise, and again, a day or two later. Because especially with strength training, you're going to have some soreness, and soreness is actually normal. It's part of the process, but it should go away. It shouldn't sustain and shouldn't include pain. It just might be sort of the buildup of that lactic acid within your muscles. So again, understanding the normal impact of strength training would also help you. So you don't get scared. You might say, oh my God, I did too much, is very helpful as well.
Yeah, I know we're down to sort of the end of our time together. I just had one more question, if we can sneak one more thing in. So Mike, if we're looking for some insights for those family members out there that are joining this call today, what is it that they can do? If you're a family member or a caregiver who supports an older adult and you really want them to either begin to have a more active lifestyle or work to maintain the one that they have, are there any specific activities or exercises that maybe they could do with their loved one or that you think are more beneficial to start with? What are your thoughts on how to keep the families involved?
Yeah, so I think the number one thing is to lead by example, right? So if you're a caregiver, whether you're a professional caregiver or an informal caregiver, and you're taking care of somebody, one of the biggest things that I see with my mom, who has COPD and is a primary caregiver to my dad, who has a diagnosis of dementia, is she doesn't see the impact of the caregiving process on her own health and on her own stress. So she's very focused on getting my dad up and being mobile. She's less focused on getting herself up and being mobile. So what I tell her is that if you can do an exercise with dad, that's fantastic. But if you can't, and maybe he's a little bit resistant, which he can be at times, is to have him see you do exercise. Have him want to spend time with you, which my dad wants to do. Have him want to spend time. So if you're enjoying walking and that's the time that he can connect with you, maybe he'll also join you in that activity. So leading by example is very important. Again, with most caregivers, getting them to understand if you're not well, you're not going to be able to make another person well. So it always starts with yourself. Making sure also that you set realistic goals. So again, caregiving can be very challenging. So, don't set yourself up for failure. So sort of going back to my previous point, if you're not doing anything with your loved one currently, try twice a week for 15 minutes. Identify where in the day is the most easy or the most opportune time to incorporate exercise. Again, maybe it's having your caregiver stand up and down from the couch multiple times, again, during that TV break. Again, my dad, as an example, spends a lot of time watching television. So what we've done was he does go out to the grocery store. So what we've done is instead of doing one grocery store trip, we do 3 a week. So again, it gets him up, gets him in the car, gets him outside, gets him in the community, and he's doing more exercise. Yes, it's more work to go out and we spend more gas and we do that whole thing, but it's his exercise session because he's not really down for more formal exercise, but he sees that as something that he can help my mom with. And we know that it's beneficial to his independence, as an example. Also be flexible. So if you see something not working, be okay with trying something new. Don't again see it as a failure. A lot of it is kind of trial by error. So, sort of what we want to kind of start off with what we think works, but be very okay with going a different direction based on the response of the patient or the loved one. And again, I always love incorporating intergenerational or the grandkids into the activities. Again, with my dad, I just focus on having him sometimes just stand for an extended period of time. So we've incorporated board games when the grandchildren come over, when we go and visit, and he loves board games all of a sudden. He didn't love them before the diagnosis, but he'll come to the table and he'll stand up and he'll play. We play sequence. He'll play that game, for an hour. So, yes, he sometimes needs breaks to lean on the island that we have and et cetera, but he's engaged socially, he's engaged emotionally, he's engaged doing this standing activity. So anything you can incorporate with family, it's a way for the patient to see as valuable to them, something they want to connect with, and then they don't identify it as an exercise or something that they don't want to do.
Yeah, I love these examples. I love the one about taking them to the grocery store multiple times a week. Even though, to your point, it might take a little extra time, you're getting extra exercise into that person's week, and it gives them some meaning and some value. So it's a win-win all the way around.
Yeah.
Well, these are some really great tips. I think our families out there can really kind of run with some of these ideas to help them get started. If they feel like they need to contact a healthcare professional, they surely have that option. As you said, there's lots of tools and resources out there on the internet or through physical therapists if you need assistance getting going. But we really appreciate you sharing all of these insights and all of your knowledge today about this important topic. And thank you for joining our Family Matters series.
Thanks for the invitation. I appreciate it. Have a wonderful day.
Great. Well, everyone, thanks for listening in, and we hope you'll join us again for our next topic. Thank you.